Hello, doctor and medical students. I am Dr. Amit. So today we'll move forward in our endocrine series, and today we'll talk about secondary and tertiary adrenal insufficiency. So let's first talk about secondary adrenal insufficiency. So secondary adrenal insufficiency occurs mainly due to decreased ACTH secretion. So the pathology mainly lies in the pituitary gland, which fails to produce adequate ACTH to stimulate the adrenal cortex. So in summary, we can say that there will be less ACTH productions from the pituitary. So there will be less stimulations of adrenal cortex. So there will be less cortisol production. Now, while talking about tertiary adrenal insufficiency, so tertiary adrenal insufficiency is mainly because of reduced CRH, cortisol releasing hormone productions from the hypothalamus. So because of low CRH, the pituitary doesn't get enough stimulations to release ACTH. This may be the cause of tertiary adrenal insufficiency. Now, while talking about the most common cause of tertiary adrenal insufficiency, then the most common cause is chronic glucocorticoid therapy. So because of chronic glucocorticoid therapy, the hypothalamus pituitary adrenal axis, there will be suppression of this axis. So because of that, there will be less release of CRH. Now we'll focus on one important aspect, that there is hyperkalemia in case of primary adrenal insufficiency, but it is usually absent in case of secondary and tertiary adrenal insufficiency. So now we'll talk why this happens. So hypokalemia is usually absent in case of secondary and tertiary adrenal insufficiency because aldosterone production is preserved in these cases, which is not prevented in case of primary adrenal insufficiency. So as we remember from our previous lecture that zona glomerulosa layer of adrenal cortex is mainly regulated by RAS, or we can be more specific that it is regulated by angiotensin 2, not by ACTH. But in case of secondary and tertiary adrenal insufficiency, there is problem in ACTH. That's why there is problem in fasciculata and reticularis layer, but not in zona glomerulosa layer. That's why there is no hyperkalemia in these cases. So now we'll do a quick recall, or we can say a difference between primary and secondary adrenal insufficiency. So primary adrenal insufficiency is mainly because of destruction in adrenal cortex, and secondary is mainly due to disruptions in hypothalamic pituitary axis. While talking about the possible etiologies, so the most common etiology is in case of primary adrenal insufficiency is autoimmune adrenalitis, infections, malignancy. But while talking about secondary, it's chronic glucocorticoid use and infiltrative disease. In case of primary adrenal insufficiency, ACTH will increase, but in case of secondary, the ACTH will decrease. Now talking about clinical feature, important difference, there will be hyperkalemia and hyperpigmentation in primary, but no hyperkalemia and hyperpigmentation in case of secondary. This is all. Thank you for watching.